authorities at the Techiman Holy Family Hospital in the Bono East region are taking bold steps capable, in their view, of preventing the spread of the disease within that facility. The hospital has provided sanitizers, there are screening points there at their entrance and advantage points within the facility. JoyNews' Anas Sabit has been monitoring that situation in Techiman. Here is his report.
The president, during an address to the nation last night, indicated that establishments such as supermarkets, shopping malls, restaurants, hotels, etc. are expected to observe enhanced hygiene procedures by providing, amongst others, hand sanitizers, running water and soap for washing of the hands. Here at the Techiman Holy Family Hospital, authorities have provided hand sanitizers here at the entrance and at vintage points within the hospital to ensure that patients and people who come into the facility do not carry the virus from their respective homes into the hospitals. They are also ensuring that any visitor from the entrance is being checked in terms of his or her temperature, providing an emergency response unit to take care of whoever is suspected to have been a carrier of the virus. Join us, we're speaking with authorities to inquire from them what informed their decision to take this giant step. Dr. Patience Amanopo is a specialist family physician and also a member of the emergency response team.
Since we recorded cases across the world, the hospital has an institution set up a committee, the emergency response team, to be responsible for taking care of patients and staff within the facility. So we had a team in place before even we recorded cases within the country. So because of that, we have provided what we call Veronica buckets all around the hospital, where patients are able to wash their hands with soap under running water. And we've also provided alcohol-based hand sanitizers all around the hospital that patients are asked to use it and taught the right way when they come into the hospital and when they are leaving. So we decided to start our screening from our main gate, where we check the temperature of anybody who is coming into the hospital, be it a staff or a patient relative. So we check the temperature of everybody. And when the temperature is 38 degrees Celsius and above, we have a checklist that we quickly administer the checklist. And based on the checklist and a scoring system, if you are a suspect, then we have our isolation area where we will send you and then take samples for testing and take it up from there.
Dr. Patience tells me, though they are yet to record a case here, they are ever ready, and then they have in place allocated rooms capable of taking any quarantine case should there be any outbreak here.
Our A&E, accident and emergency, was actually designed and a room was created for cases of that sort. We've had that room that we've always kept other cases that we wanted to isolate. But now, since this disease came, we've cleared out that room. And so that room is available to hold cases. We also have a second holding area at a different location. When you go inside the hospital, there's a second holding area. We've also identified facilities that we have that we can use to quarantine staff who become exposed.
As a facility which is more or less a referral center for most of the communities within the Bono East region and then some parts of the northern and upper west regions, they have a huge challenge so far as this outbreak is concerned. The hospital is without a ventilator, and so when cases are being referred to this place, it will be difficult for them to at least respond to them by providing respiratory services.
As a facility, we do not have a ventilator. So meanwhile, we serve a large population, all referrals from Kintampo, Atebibu, Jema, and some parts of even the northern region and the upper west region all come here. And so if patients are referred here and they need respiratory support, we will not be able to give them that.
To some members of the public who have been speaking with us, this move by the authorities is a bold step worth commendation, and they want other public institutions to emulate same.
It's a laudable initiative because it's part of the preventive aspect. It's going to help in at least prevent about 99% of it. You see, we are in a country that we are not taking the preventive aspect very serious. We care much about the curative more than the preventive, which is as a result of what we are seeing now. So suppose this aspect of exercise being initiated by Holy Family Hospital, Techiman, even though it's not going to curb it anyway, but it's going to reduce it.
We are being asked to wash our hands and use hand sanitizers, and once we do that, we are not going to be infected. So when you do as instructed, you will be protected. The leadership has done really well for this provision. We thank them so much.
Good for any woman be here. When you're coming inside, they stop you, they protect you before coming inside. So making me fine. So this morning, those people come here plenty, they test everybody. They take your temperature, wash your hand, so they are down with.
From the Holy Family Hospital, we moved to the Techiman campus of the Valley View University, where all academic activities has been suspended, including a matriculation ceremony slated to take place on Thursday, March 19th. Professor Peter Ajikum Boateng is director of the institution.
Valley View University, Techiman campus had plans for this semester, and one of the major activities was to have our matriculation ceremony on Thursday. Unfortunately, we have had to cancel that celebration due to the outbreak of the virus COVID-19. And in addition to this, we've also, in line with the directives we received last night from the President of Ghana, we have called off all academic activities. We have suspended everything we were doing on this campus. That is to say, we have closed down the institution for now until we will be asked to continue.
From the Techiman Holy Family Hospital, I am Anas Sabit for JoyNews.